So I'm back with larynx. Larynx is a tricky topic, but I'll try to make it as easier as possible. So in this slide you can see that this part is the larynx till here, and below it continues as trachea. So the lower extent of larynx is into the trachea. The level of larynx is between the C3 and C6 vertebrae. C3 is the level of epiglottis and C6 is the level of the lower border of cricoid cartilage. So the larynx extends from epiglottis above till the lower border of cricoid cartilage below, and according to the vertebrae it is between the C3 vertebrae till the C6 vertebra. The laryngeal skeleton includes multiple cartilages. These are paired and unpaired. Three of these are unpaired and the rest three are paired. So the three paired cartilages are the arytenoids, the corniculates, and the cuneiforms. And the unpaired cartilages are this green epiglottis, this rust colored thyroid cartilage, and this yellow colored cricoid cartilage. In this picture, we can see that this large cartilage is the thyroid cartilage. This circular cartilage is cricoid cartilage, and this leaf-shaped cartilage is the epiglottis. All these three are unpaired. And this triangular pyramid-shaped cartilage is arytenoids. These are two, so it is paired. On top of these are the corniculate cartilages. They are also two. And just above these is the cuneiform cartilage. They are also paired. Now we'll discuss these cartilages one by one. Before that, an interesting fact is that all these cartilages are hyaline variety except for the epiglottis, that is the elastic cartilage. So E for epiglottis and E for elastic cartilage. Rest are hyaline cartilages. So thyroid cartilage, this entire cartilage is one single thyroid cartilage. It is unpaired hyaline variety. It has two laminae on the side. In front, it has a laryngeal prominence, which is called the Adam's apple. When we look from behind, it has superior horns and inferior horns. On the laminae is a line called the oblique line. So this is about the thyroid cartilage. Now another important structure is the thyroid membrane. As the name indicates, it extends between the thyroid cartilage below till the hyoid bone above. So between the hyoid and the thyroid cartilage is the thyroid membrane. This transparent membrane, as you can see, is the thyroid membrane. An interesting fact of this thyroid membrane is that it is pierced by the internal laryngeal nerve and the superior laryngeal artery. This is a very important fact. You can see this hole. This is the area of structures piercing this. So the structures are the internal laryngeal nerve and the superior laryngeal artery. Next is the cricothyroid joint. As you can see, this cricoid cartilage and the lower inferior horn of the thyroid cartilage are making a joint here, which is the cricothyroid joint. Now we'll discuss the epiglottic cartilage. This is a leaf-shaped cartilage. It is elastic in nature, and then its exact location is it is just behind the root of the tongue and the hyoid bone, and it is anterior to the laryngeal inlet. Next is cricoid cartilage. The cricoid cartilage is signet ring shaped. As you can see, this circular cartilage is cricoid cartilage. It is in the form of a complete circle or a ring. The anterior part of the cartilage is called the arch, and this posterior broad part is the lamina. Next, all three that we have discussed till now are the unpaired cartilages. Now we'll discuss about the paired cartilages. So first of all, we'll discuss the arytenoid cartilages. This pyramid-shaped cartilage, these two pyramid-shaped cartilages are the arytenoid cartilages. They are making a joint with the cricoid cartilage, the cricoarytenoid joint, and they are triangular in shape. As you can see from the side, it has an apex above, a base below, and two processes. This anterior process is the vocal process, and this lateral process is the muscular process where important muscles are attached. The vocal process gives attachment to the vocal ligament, and the apex gives attachment to these tiny corniculate cartilages. So we have two arytenoid cartilages and two tiny corniculate cartilages on top of the apex of the arytenoid cartilages. The muscular process that is directed laterally gives attachment to two very important muscles, which are the posterior and lateral cricoarytenoid muscles, as you can see in this picture. This is the muscular process giving attachment to the lateral cricoarytenoid muscle and the posterior cricoarytenoid muscles. The corniculate cartilages, as I have told you before, are these green tiny cartilages that lie on top of the apex of the two arytenoid cartilages. The cuneiforms are lying just anterior to the corniculate cartilages, and both the corniculate and the cuneiform cartilages lie in the airy epiglottic fold. This fold is called the airy epiglottic fold, and in this fold are the two cartilages, the paired corniculate cartilages and the paired cuneiform cartilages. Now we have certain laryngeal ligaments and membranes. Laryngeal ligaments are extrinsic as well as intrinsic. We'll discuss them one by one. First of all, the extrinsic ligaments have the thyroid membrane that I've discussed before, which is giving superior laryngeal artery and the internal laryngeal nerve are piercing this thyroid membrane that is between the thyroid cartilage below and the hyoid bone above. In addition to that, the medial portion of the thyroid membrane is thickened to form the median thyroid ligament, and the lateral edges are thickened to form the lateral thyroid ligaments. Now, the next ligament is the thyroepiglottic ligament that is between the thyroid cartilage and the epiglottis. And another ligament is the hyoepiglottic ligament that is between the hyoid bone and the epiglottis. An important membrane is the quadrangular membrane. Quadrangular membrane this is the quadrangular membrane. It extends between the epiglottis and the arytenoid cartilages. An interesting fact of this quadrangular membrane is that its inferior margin is thickened, and that part is called the vestibular ligament, and it is covered by a fold of mucous membrane that after that fold mucous membrane covering, the vestibular ligament is now called the vestibular fold, and this structure is very important when we'll discuss the inside of the larynx. So this quadrangular membrane that lies between the arytenoids and the epiglottis have an inferior margin thickening forming the vestibular fold, and the upper margin is forming the airy epiglottic fold. An important fact that I told you in the previous slides is that the airy epiglottic fold contains two paired cartilages, the corniculates and the cuneiforms. Next is the conus elasticus or cricovocal membrane. It is thickened and its superior border forms the vocal ligament. Vocal ligament is covered by a fold of mucous membrane, and now it is called the vocal fold. And just like vestibular fold, vocal fold holds great significance. In this picture, we can see that this central empty space is called the rima glottidis. This space is between the two vocal ligaments. These are the two vocal ligaments on either side of the rima glottidis. Lateral to the vocal folds are the vestibular folds, and lateral to the vestibular folds, this brownish structure is the quadrangular membrane. In next in next slides, I'll discuss interior of the larynx or laryngeal cavity. That's all for today. If you have any confusion, you can ask me in the comment section. Thank you.